بسم الله الرحمن الرحيم والصلاة والسلام على رسول الله. السادة الحضور، أسعد الله مساءكم جميعا. Good morning and good afternoon for the attendees who are participating from across the ocean and the other area with different time zone. We have attendees from about 49 countries, which is very good to have it in this interesting webinar. So let me introduce myself at first. This is Professor Abdullah Mutwalli, Naseej Academy General Supervisor and Library and Information Science Professor at Cairo University. I'm honored to host and moderate this webinar for the coming 2 hours, inshallah. As the whole communication during this webinar will be in English, I would like to give an introduction, a brief one in Arabic. السيدات والسادة، معكم دكتور عبد الله متولي، المشرف العام على أكاديمية نسيج وأستاذ المكتبات والمعلومات بجامعة القاهرة. ورحب بكم في ندوة الليلة، والتي تعد خير ختام لباقة الندوات العلمية التي عقدتها أكاديمية نسيج خلال عام 2020 أو 2020، والتي تجاوز عدد الذين سجلوا بها جميعا ما يزيد على 7600 شخص، وحضرها فعليا ما يزيد على 2800 مشارك، وتحدث فيها 26 خبير وأكاديمي من العلماء المبرزين في عالمنا العربي ومن الولايات المتحدة الأمريكية من أوروبا، مما يطمئننا إلى أن الأكاديمية نسيج تسير بخطى ثابتة وواعية ومبادرة طموح أطلقتها نسيج منذ نحو 5 سنوات كجزء من مسؤولياتها الاجتماعية تجاه قطاع المعرفة والمكتبات في العالم العربي، وأيضا من أجل تنميته من خلال دعم وتطوير القيادات العاملة في القطاع المعرفي والأكاديمي في العالم العربي، بتقديم ورعاية العديد من البرامج والأنشطة المهمة والمتنوعة بالتعاون مع جهات محلية وإقليمية وعالمية رائدة. ومركز مورتنسون تابع لجامعة إلينوي هو أحد هذه المراكز، والذي نتشارك معه في إدارة هذه الندوة العلمية. وموضوع ندوتنا الليلة يرتبط بما نعيشه نحن والعالم لما يقرب من عام كامل الآن، وهو جائحة كوفيد-19. ورغم زخم الندوات وورش العمل التي تناولت تأثيرات تلك الجائحة سواء على الصعيد الصحي أو الاقتصادي أو حتى الاجتماعي، إلا أننا ننظر لها في ندوتنا الليلة من منظور مختلف، منظور يناقش انعكاساتها على مجال المكتبات بمختلف مكوناته من مؤسسات وأنشطة وخدمات ومكتبيين وأكاديميين ومستفيدين على اختلاف أطيافهم وتوجهاتهم البحثية. وليس أدل على وجود هذه الجائحة وضرورة مواجهتها من ظهور بعض الدراسات والتوجهات والمصطلحات التي عاينتها وتزامنت مع ظهورها، ومن أبرزها ما يمكن أن نطلق عليه جائحة المعلوماتية أو الانفوديميك. ندوتنا الليلة تتناول موضوع المعلوماتية والمعلومات اللقاحية ودور المكتبات خلال جائحة كوفيد-19. ومصطلح المعلوماتية infodemic هو مصطلح هجين بورتمنتو سُك في عام 2002، وهو مثل مصطلحات أخرى كثيرة كالنقحرة من النقل الحرفي أو ترانسليتريشن، والثير الذاتية المطعمة بالصور بايو بيك من بايوغرافي وبيكتشر، وأخيرا برانش من بريكفاست اند لانش. ومصطلح المعلوماتية infodemic يجمع بين كلمتي معلومات information ووبائي epidemic، وهو يشير إلى البث والنشر السريع والهائل لكافة أنواع المعلومات الصحية سواء الموثوقة أو غير الموثوقة المضللة عبر قنوات الاتصال والتواصل المختلفة. ويعد هذا المصطلح مناسبا تماما لوصف الوضع الراهن الذي نعيشه الآن، والذي يعاني من هذا النمط من نشر المعلومات، والذي يؤدي لزيادة هائلة في كم المعلومات التي بعضها دقيق والبعض الآخر غير دقيق، تماما كانتشار الوباء بين البشر. إن المعلوماتية المرتبطة بجائحة كوفيد-19 نتج عنها عواقب وخيمة، مما اضطر منظومة الصحة العالمية والمؤسسات العاملة في تخصصات مختلفة إلى التعاون في إجراء الأبحاث والدراسات لمواجهة المعلوماتية. ونحن هنا نواجهها بالمعرفة من خلال استضافة 3 من الخبراء المتخصصين للإجابة على السؤال الأبرز هنا: كيف يمكن للمكتبات ومؤسسات المعلومات مواجهة جائحة المعلوماتية هذه كجزء لا يتجزأ من سعيها لمواجهة جائحة كوفيد-19؟ ونستضيف للحديث عنها البروفيسور كلارا شو، مديرة مركز مورتنسون والمشرفة على البرنامج الدولي للمكتبات بجامعة إلينوي، والرئيس الحالي المنتخب لجمعية علم المعلومات والتكنولوجيا، والتي شاركت في تأسيس معهد الذكاء الاصطناعي والمكتبات، وهي شريك أصيل مع أكاديمية نسيج في العديد من الأنشطة والبرامج، من بينها برنامج الأسوشيت بروجرام الذي يبتعث سنويا 2 من المكتبيين في العالم العربي. وأيضا معنا بروفيسور كندرا ألبرت، متخصصة في إدارة المعرفة بمدرسة المعلومات بجامعة ولاية كنت، ورئيسة تحرير مجلة Libri، وهي مجلة علمية دولية في مجال المكتبات ودراسات المعلومات، وهي مستشارة لعدد كبير من المؤسسات الحكومية والقطاع الخاص. ومعنا أيضا بروفيسور بهارات مهرا، وهو بروفيسور بمدرسة المكتبات ودراسات المعلومات بجامعة ألاباما، وخبير وقائد في العدالة الاجتماعية والتنوع في مجال المكتبات وعلم المعلومات، ومتخصص في المعلوماتية المجتمعية، والتي تركز على استخدام المعلومات وتكنولوجيا الاتصالات لتمكين ودعم الأقليات والفئات المهمشة التي تحتاج إلى الخدمات المعلوماتية. معي ومعكم هذه الباقة من الخبراء، وأترك المجال للحديث معهما. Dear fellows, it was a brief introduction about you and the topic of today, and now I leave the virtual floor for you. So would you please start, Professor Clara, please?
Thank you, Dr. Abdallah. It's a pleasure to welcome all of you and greetings from the United States. I'm Clara Chu, Director and Mortenson Distinguished Professor at the Mortenson Center for International Library Programs at the University of Illinois at Urbana-Champaign. It's wonderful to be in this webinar where it's sponsored by the Mortenson Center as well as Naseej Academy. And we would like us co-facilitators welcome all of you from different parts of the world, whether it's morning or afternoon or evening, and invite you to write on chat where you're joining us from. Please share with us if you're your city, your country, and your institution. So we would like to know where from different parts of the world you're coming from. And so as I indicated, we will be a team doing this presentation. And so as I indicated, I'm Clara Chu, and with me are also.
I'm Kendra Albright, and good morning, afternoon, evening, wherever you may be. And I'm coming to you today from Nashville, Tennessee, the home of country music. And I'm very pleased to be here with you today.
Hi, I'm Bharat Mehra. I'm the EBSCO Endowed Chair in Social Justice and Professor at the University of Alabama. And I want to welcome you and thank you for being there during this session. It's really exciting to see people coming from so many parts of the world, from Sudan to Nigeria to Lebanon to Saudi Arabia to the United States, Bangladesh, India, Czech Republic, Oman. And so it's wonderful, and I'm looking forward to a really engaging presentation and discussion with all of you. Next.
And as we indicated, the focus on our webinar is going to be Infodemic. How many of you have heard of Infodemic? And if you have, please type yes on chat that you have. And we will also be addressing the information vaccine and what libraries can do during the COVID-19 pandemic. So we have 3 objectives for our webinar. And during the next 2 hours, we're going to introduce the COVID-19 related infodemic and the need for the information vaccine, as Kendra Albright has done work starting in 2006 on this issue and its significance for libraries. We'll also have the opportunity to explore solutions that library and information specialists can undertake through a discussion of experiences with infodemics. And then lastly, we want to present ideas and actions that library and information specialists can undertake as solutions and prevent the spread of the COVID-19 related infodemic. So what kind of situation do we face ourselves in currently with the COVID-19 pandemic? As you can see, starting early on in this year, we first experienced our surge in many parts of the world. And so that happened around the end of March into April. Then in some parts of the world, then it stayed flat. It increased, but not as much. And we can see that the case was pretty flat in Oceania and then a little bit in Africa, but there was a surge in other parts of the world. And then we've experienced various surges throughout the year. And now with Europe that didn't experience a very heavy second surge, it did experience the second heavy surge more recently. And here in North America, we're into our third surge. And so this has meant something very specific in terms of the information that's coming out. And what we are finding is that there is an overabundance of information during this time. And some of this information is false and potentially harmful. But what we're seeing is that it is spreading widely and at a rapid speed. So why is it that we are more vulnerable during this time in terms of the information that we get and whether we find that we believe it or we find that it's true or not? One of the reasons is that we're experiencing social isolation, which creates a craving for information. So we may be more open to be looking at information as well as not knowing exactly that surge of information, whether it's reliable or not. We are also finding that experts are potentially contradicting each other. Experts meaning individuals that have supposedly the experience, education, or titles, job titles to indicate so. And then in some cases, because we didn't have information in the United States here, we first indicated that it wasn't important to use masks. But however, with more scientific data, we found that the experts were telling us that indeed, initially they were wrong and that we do need to be wearing masks. Also, because of the different messages and the potentially intent and impact, then there is also the politicizing of messages. So what do we do in situations like this? And some of our trusted organizations have responded. The World Health Organization has created what are called Mythbusters. So this is information on different issues. So then the public can have specific answers that are based on scientific and factual information. So one example is, are hand dryers effective in killing the new coronavirus? And so the World Health Organization, the WHO, is telling us that this is not the case, but what we can do in the situation. The WHO has also responded not just with information regarding specific information topics, but they also want to know what is going on that is producing misinformation. So if the public has encountered this, then the WHO wants to hear about it. And this is possible through various means. So you can get in touch with the WHO through YouTube, WhatsApp, Twitter, and so forth to report any misinformation. Another trusted organization, the United Nations, has found that we do need to fight an epidemic and harmful falsehoods and lies. And the way that they have done this is starting in April, that the UN has created what they're calling the UN Communications Response Initiative. And this initiative is to spread facts and science, countering the scourge of misinformation. And so this is a critical poison as they define it. Also, the World Health Organization has invited and was able to present its first infodemiology conference. And as part of the overall WHO effort and through this conference and other activities of the infodemic management and others, the scientific community has responded, but not as individual disciplines, but they consider that this is a critical enough issue that they want to be able to do this as a multidisciplinary, interdisciplinary effort. So one of these efforts is for 5 different journals to be able to issue the same call for papers, and all of this to address this information crisis, because unless we do it together and bring together different voices, it is a challenging issue to address. So we hear that the scientific community and other international trusted organizations have responded. So how have libraries responded? One is to use some of the general approaches that we use already in information literacy, such as using the trusted checklist that is, or strategy that has been promoted by the International Federation of Library Associations and Institutions, IFLA, and we can see that libraries are promoting that use. We are also seeing that that libraries are promoting other strategies, and there is this one, which is many of you may be familiar with, currency, relevance, authority, accuracy, and purpose, to check for these things, or the acronym that is called CRAP. So we're focusing general approaches towards what the COVID-19 pandemic and the infodemic that is created. So in the law librarianship field, this has also been tackled. And the law librarians have decided to examine this and provide information at the international level. And so there was a webinar that was held, and in this webinar, resources were created that would tackle the infodemic, focusing on resources from Europe and from Africa and Asia and other parts of the world. And also, from the national perspective, just as another example, the American Library Association has created a Libraries Response webpage to provide resources. And one of the things that is critical from the United States perspective is that we're tackling the particular infodemic during COVID-19, not only in terms of the overabundance of information, but because some of that information has raised racial fears and anxieties. In the United States, there's been reference to the COVID-19 virus as a China virus. And so instead of looking at it and describing it in more general terms, then is creating an association of the virus with a particular country, and then this is associated with a particular group, such as the Asian American community here in the United States. On this page also are library resources, which are helpful in terms of responding by libraries, as well as news coverage. News coverage just to highlight new developments, new issues that we should be concerned about. Libraries not only provide information resources and also strategies to think critically in order to assess information, but we also have been responding in terms of contributing to shaping policy around when infodemics occur or how to address them. And so this particular online library called the Society Library has been part of the effort by the Forum on Information and Democracy's Working Group on Infodemics to design a policy framework to address infodemics. So a summary of what we've encountered so far is that libraries have mainly responded by addressing and focusing on the strategies that have really worked well, which is information literacy, and to have us think critically about misinformation. And so we have been able to, as a library community overall, provide authoritative resources. We have been frequently updating these resources, and we highlight resources from around the world. So libraries around the world have been contributing to updating and providing information literacy information to counteract misinformation or the current infodemic. We have also not done this work by ourselves, but we know to be able to tackle this, then we need to work with external agencies. So whether those agencies or organizations may be research oriented, may be schools, may be government agencies. So we are also not trying to do all the work by ourselves. We are collaborating and also engaging information that is coming from different organizations outside of the library and information community. And so the information literacy focus has allowed us to build on past efforts and use strategies that our users are able to understand and easily apply. So in terms of information on the infodemic itself, then we find that there is some coverage on this, and the focus is increasing. But as I indicated already, the focus has been to recognize this more in general as a misinformation issue and not necessarily focus on this notion of an infodemic. Those who have already started to develop strategies and resources then are creating authoritative resources. They are frequently updating them, and they're also responses from different parts of the world, as well as thinking about this issue globally. And so we have virtual webinars and virtual dialogues that provide most up-to-date developments. Because oftentimes, instead of waiting for something to be published, it's good to be able to share resources through online engagement. So something that we haven't found as much to address, and this is something that we will be doing during this session, is to think about what are the causes of an infodemic or misinformation. And so what are some potential areas of work that we can do to address the start of an infodemic and also recognize and not just deal with it, but also stop it. And so that is the background and for how libraries have responded. So what is this issue of an infodemic? The term infodemic was first coined by Gunther Eisenbach in his article in 2002, The Epidemiology of Misinformation. And so he's been doing this work now for almost 20 years. So when the UN announced that it was developing its communications response initiative, one of the things that he stated, because of his 20 years of experience, is that what we have learned of 20 years in doing infodemiology research is that the quality of health information is an elusive concept as in medicine. The truth is not always easy to determine, especially in a rapid evolving situation. And so what is the definition of infodemic? We will find that when we look at the literature, then we have some variations on the definition. Some have focused on it applying to health information only. Then others have indicated that is misinformation during a pandemic. And so there are both uses. In our estimation from looking at the literature, the working definition that we're applying is that infodemic is used to denote a rapid, large-scale dissemination of all kinds of health information and misinformation through a variety of media and informational channels. So large scale meaning that it's impacting the whole world. So not just certain countries or certain smaller areas, but as in a pandemic, an infodemic is rapid and large scale. And we are very concerned that this information be trustworthy and reliable. And so this leads to a new field of research that has developed that is called infodemiology. And in this field of research, we want to grapple and understand how it is that infodemics develop and how to cope with it. And so it's a field that for it to be successful requires a novel, complex synthesis of specialist knowledge from many different existing disciplines. Whoops. So now I'll turn it over to Kendra.
Thank you, Clara. That was very helpful. And I would add to what she was saying, what Clara was saying about infodemics. And when she posed the question to you, how many of you have heard about infodemics? It's a surprising number of you who said, yes, you had heard from it. It's a lot of you. In fact, it's most of you who have heard of infodemics. And of course, one of the most important components of infodemics is the need for trustworthy and reliable guidance and accuracy in our information. So what I have here on your slide is information about misinformation and disinformation, which have to do with the difference, although they differ by intent. So misinformation, for example, is non-intentional. It happens by mistake or when something has changed and the information is no longer accurate, but we don't know that yet. or we believe something to be true until we know more and it turns out to be false. The example I think of with that was my mother's old saying that when you're sick, you should have chicken soup. And we all called that an old wives' tale, when in reality, there was some truth, as science found out later, that chicken soup really does have medicinal properties that can make you feel better when you have a cold. So that would be misinformation, whereas disinformation is intentional. Examples of that might be propaganda. It is a purposeful act intended to deceive or to mislead. But regardless of whether it's mis or disinformation, our goal as library and information professionals is to ensure the dissemination of accurate, factual information that is neither misinformation or disinformation. Next slide, please. So what experiences do we have to draw from when we think about COVID-19, for example, and information? In 2006, I had brought together a number of different studies that I had been doing in Uganda about how they had been so successful at reducing the prevalence of HIV without the use of medicines. Uganda was the one country of the world that was really prominent in having change their behavior in order to drop the prevalence of HIV. And so I realized when I reflected back on the studies that we had done between 2002 and 2006, that what they had done was to create an information vaccine. So thus I defined an information vaccine as the information, education, and communication strategies used to facilitate behavioral actions to prevent the spread of a particular disease and use accurate, authoritative, and factual components that are designed for a specific audience. Next slide. So in that case, the information vaccine is very important because these are examples, there are examples throughout history as well as today when we don't have a cure for a medical disease, but we need to ensure that it doesn't spread to other people. COVID-19 is clearly the issue right now. My example that I'm using here is HIV/AIDS from my previous work, but now we see some of the same applications we could use and draw from in COVID-19. So let me give you a little bit more detail about how Uganda was so successful at preventing the spread of HIV without medical help. So as I described the project here in Uganda, I want you to be thinking about how that might relate to COVID-19 because we might be asking you some questions about your thoughts about that. So as I said, Uganda was the single most successful country in the world to reduce the prevalence of HIV through behavioral change. And because there was no affordable, accessible, or antiretroviral medicines available to them at the time, they had to rely on behavioral change. So my colleague, Dick Kawuya, he's from Uganda, and his mother was a nurse working on the Rakai project, which is where they first discovered the virus. We conducted a number of studies, as I said, between 2002 and 2006 to see how they accomplished this. And here you see a kind of a depiction of how they did that. On the left-hand side, you see the IEC strategy. That's the information, education, and communication strategy that was composed of content and dissemination. The content was the ABC strategy, which consisted of abstinence, being faithful, the ABC strategy, and condoms, ABC. If you think about COVID-19, you could think of abstinence as being equivalent to like lockdown, be faithful like social distancing, and condoms would be like wearing masks. So this was just a parallel for me to draw to give you an example of how these two might fit together. Also, they disseminated information in three primary ways. They did this through interpersonal communication, which was by far and away the most prevalent way of disseminating information, which was extremely important for them to be factual and have accurate information. Our first study in Uganda looked at what information did people know throughout the country, and even the most rural parts. There was a surprising accuracy to the amount of information that they had. And so interpersonal communication became an important vehicle to spreading factual information. Radio and drama were also information means, dissemination means. Radio typically would be fact-based, but there could be certain biases that were introduced in the information content. And drama was typically could be completely misinformation or disinformation. So there were certain aspects that they had to be aware of, but regardless, one of the most important things was they were talking about it. And on the right-hand side, you see the structure that was necessary to support the information and education communication strategy that came from a multi-sectoral structure that included government, civil society, as well as cultural aspects. And so what you have in Uganda is basically a 7-layer set of government that went from the president on down, president down to the Uganda AIDS Commission that established the national HIV/AIDS policy, all the way down to the very bottom layer of government, which is quasi grouped together with civil society. And so those 7 layers of government created a vertical structure that each layer had its own form of information that was being disseminated, that was factual and accurate about HIV/AIDS. Thus, it created, as you see there, an IEC grid. So there was information everywhere about HIV/AIDS. Further, it was supported through the acknowledgement and the openness, the transparency about HIV as being a national problem. President Yoweri Museveni, who's still president, came out very publicly and said that Uganda had this problem and needed to embrace it and to try to reduce stigma about it. And as you can see there, one of the Uganda musicians, Philip Bongoli Lataya, was very public about having HIV, and he subsequently died. But the process of him revealing his HIV/AIDS gave it a reduced stigma because people thought so highly of him. So those are some of the lessons that we learned in the process of HIV information. So now you've heard about a lot of things thus far. You've heard about infodemics, you've heard about information vaccine, and now we'd like to hear from you. So we have 2 questions for you, you see here, and what we'd like you to do is to type your answers in chat. And Clara is going to record some of these. We can't record, of course, everyone's comments, but we would like to hear some of them. I'm going to read some of them out loud as you guys type them in, and we will make this all available to you later so that you can see what kinds of stuff. We'll compile the results and then put those back out where you can find them. So the first question that we have here is, what experiences, so many of you have heard of infodemics, what experiences do you have with it? So that's the first question, and I'm going to give you a good chance to respond to this one before we move on to the second one. So please type in your answers to the question of what experiences you have with infodemics. Another way of looking at would be, what evidence do you have from infodemics? I can certainly tell you in the United States, there's a lot of mis and disinformation about COVID-19. So let's see here. Acquaintances who are prone to believe hogwash will sometimes ask me as a librarian what the real story is, then they won't believe me when I tell them. Yeah, that's a good one. Yeah. Let's see, what else do we have? Social media feeds from friends and family. That's another form of dealing with infodemics. Library patrons coming in with conspiracy theories they have seen on Facebook. Yeah. Let's see. Religious aspects, like it is not for specific religious purposes. We see that one in the US as well. Yep. And Bharat, I'm going to ask you to help me with some of this because my chat is a little troublesome. Here we go. Let's see what else. A lot of hearsay. Also, working patients and the public around cancer cures and COVID-19 misinformation through social media, as well as personal and private spaces. Yeah. Yes, I see Chris from the U.S. is saying the current U.S. election stories. It's an amazing process that's happened in the U.S. that we have gotten politics and medical news considered to be fake news because of the political situation. Right. Home remedies. That's another one. That's right. Home remedies. Yeah. One of the things we encountered in Uganda was a lot of indigenous medicine beliefs that weren't necessarily based in fact, and that was sometimes very difficult to counter. Literacy plays a vital role in many parts of the world, especially Africa. It's not just especially Africa. The United States could use a lot of that right now. Fake vaccine and concoctions claiming to be the cure for COVID-19. That's good. Patrons usually share false and misleading updates with their colleagues. Unintentionally, I hear them when they are passing by the circulation desk. Yeah. Right. Oh, these are good ones. Receiving videos about remedies for COVID-19. Okay, well, you guys are moving on to the next question, so we'll go with that. The second question is, what do you propose as the information vaccine? What kinds of ideas and solutions might you have, ideas and actions? So along the lines of that, let's see, we've got a couple of people already answering that. Librarians are often invisible when our systems and services when our systems and services are working well. We need to turn that around. That's good. Let's see. Existence of reliable sources of information and using official channels. Yeah, that's good too. Yeah. Provide cited information. Get librarian and information professional faces on TV and out in the media like medical and legal experts. That's a really good point. Yeah. If librarians are more visible to the public as trusted information experts, we can spread accurate information more widely and easily. Librarians should leave their seats and go to the grassroots to spread accurate information, getting out in the field. That's a lot of what they were doing in Uganda, by the way. Yeah. More responsibility to librarians in the information dissemination. Have people teach, have people evaluate information. I have worked already since March to create a reliable resource center which targets professionals as well as health consumers and updating it daily. That's really good. Neutral language when conveying authoritative information. Yep. Neighborhood outreach.
Kendra,
Information literacy for all. Yeah.
Yeah. I think there is one you missed. It's very interesting. Building trust in people who work in information is critical, I guess.
Yes, that's really good. There are so many good ideas here. I'm sorry I can't get to all of them.
I'm here. I'm working with you. I'm helping this because we have a flow of ideas, which is very interesting. Okay, go ahead.
Yes, this is very good. And thank you. I appreciate that. Mark fake facts as fake facts wherever possible. Censorship creates mistrust, distrust. So important to have open, respectful conversations, to focus conversations on evidence, but also to respect people even when they make decisions you disagree with. That's good. Target on journalists with information on vaccine. Yep, information vaccine and journalism should go together. You know, it's an interesting, this is interesting, training of librarians. I think there's a certain aspect of that. As a library and information science educator, that is something that I think about a lot, yeah. Providing trusted medical information, being an ideal for patrons by behaving in a very cautious way, right. These are excellent. Training on Infodemic using WHO guidelines of first Infodemic manager training. That's really good. RSS feeds to be shared with patrons. Now this is interesting. I think these are all great ideas, but they mostly cannot address the underlying epistemic disconnections that drive things like conspiracy belief. No prophylactic approach will be effective without a common base of facts. And I would add to that that common base of facts should be accepted. And that's always a challenge. Try not to reinforce the false message, but regard circulated the facts more and give authoritative reasons why the misinformation is wrong. Government should stop lying too, putting out that disinformation. Yeah, we've had that challenge this time around. These are wonderful ideas. Well, we've got a lot of really good ideas here, and I think we could probably keep going all day with this. This is a whole nother workshop, I think, unto itself. But I would thank all of you for those ideas, and feel free to keep adding them. We have a lot of time left, so that's fine that you can keep adding some of these. But I think for now, what we'll do is move on to the next step of the workshop. And I thank you for your great ideas, many of which can all apply, and others that are worthy of further detail and development. So at this point, I would like to turn this back over to our colleagues and give this to Bharat, who will lead us in addressing solutions. Thank you.
Thanks. Can we have the next slide? Thanks so much, Kendra and Clara, for setting the background and seeking information from our audience, who have given us such a rich narrative related to the various issues and problems of how they have encountered and what problems they see moving forward in addressing the infodemic in their roles as librarian and information professionals. So here, I am going to share with you some thematic questions and issues related to the role of librarians and information professionals to consider as we try to find and apply solutions moving forward into the future, while responding to the chaotic mess that we find ourselves at political, economic, cultural, and social levels in terms of implications of the pandemic. And do keep considering how some of these thematic issues and concerns and questions play themselves out in your own settings, and how have you navigated, or how are you thinking of navigating some of these in terms of efforts moving forward. So the first one, libraries and technology. What difference will it make to our core values of privacy and intellectual freedom as we are encountering big data and tracking technologies during the infodemic? And how will librarians and libraries help community members understand the levels of information that is being collected in different spaces, and the necessity for institutions to report or share information with public health officials or other members of the public? Next topic about libraries and their role in developing, investing in technologies like automated book sorters, robotic book retrieval systems, and other contactless technologies, services, drones, robots, etc. Further, in terms of our role in community engagement and civic engagement and policy development, how can we as institutions that promote democracy and freedom of ideas, how will we play a role in supporting these conversations and discourses and spaces in the public forum that embody these principles in the infodemic age? How does this translate into our roles beyond the traditional roles that we have been playing? And one of the things that it implies is that we will be, during the infodemic, libraries are going to become and will be becoming more important players in the news and journal ecosystem. Many libraries are already promoting local journalism or playing direct roles in producing local news, and those functions which may become even more important in a downturned economy where public health information is critically important. Some of these have been built upon and adapted from the information shared in the coronavirus pandemic that the ALA has developed. And of course, you can find the link there. Can I have the next slide? Further, tying it to our economic well-being and economic development. During the infodemic, libraries librarians' roles in workforce resource development, community cohesion, and as cultural assets could become increasingly important for governments interested in developing robust and diversified economies. During the infodemic, we were encountering high levels of unemployment and furloughs from the retail sector. And so libraries may need to help residents navigate a significantly contracted employment sector where only a large retailers control the marketplace. While libraries already provide many services to support job seekers, their consolidation of retail and restaurants will likely displace managers and career retail and restaurant workers. Further, our role in supporting the underserved and the marginalized and providing access to information as a means of personal and societal liberation. Libraries may also take this opportunity to further examine our own systems and policies that are not fair and that impede individuals' use of the services. In the context of telemedicine, where experts can be sought and connected through online, how do we improve access to the healthcare? It is dependent on equitable access to high-speed connectivity for both healthcare providers and recipients, a reality that might not exist in many parts of the world. If telemedicine becomes a widely promoted tool to address healthcare access within the infodemic situation, will libraries be prepared to meet user demand for such services, including connectivity, equipment, meeting rooms, and the resulting information and privacy implications that are attached to these transactions? Next slide. Thanks. So now, some examples of possible solutions. We see examples of some that are already happening and others that will happen. And we understood these to be in three different categories and topic areas. First, of course, content related. Second is skill development. And third is research, advocacy, and policy. So the first one relates with authority, balanced perspective, literacy appropriate, expertise. That's the traditional dimensions of our role as information professionals and librarians. Second one is looking at topic of skill development, which is information literacy. We are also now looking at multiple literacies to skills where, because we need to be aware of other forms of literacies, which is health literacy, data literacy, news literacy, media literacy, as well as linguistic differences. Topic of critical thinking and cultural competency. We have issues of cybersecurity, early and ongoing skill development. And the third one is research, advocacy, and policy development, which is going beyond our roles as passive neutral bystanders while the enactment of life and community activities take place. We have to be able to reach out and be more proactive in assertively playing a role in making a difference to some of the dysfunctional aspects of reality that many of you have indicated on the text chat. Part of that involves convergence research. That there are two elements of convergence research that the National Science Foundation has articulated. Research driven by a specific and compelling problem. Convergence research is generally inspired by the need to address a specific challenge or opportunity, whether it arises from deep scientific questions or pressing societal needs. Also, deep integration across disciplines. As experts from different disciplines pursue common research challenges, their knowledge, theories, methods, data, research communities, languages, methods, methodologies, strategies become increasingly intermingled or integrated. New frameworks, paradigms, or even disciplines can form sustained interactions across these multiple boundaries. Engaging proactively with governance and leadership. Recognizing users' socio-cultural context and recognizing users as key participants and getting involved and connected with them in being able to address some of the issues related with information creation, organization, management, dissemination. Advancing libraries and government policies are some of the categories within which we see future initiatives and strategies happening. Can I have the next slide? So here we see an example from the Kitsap Regional Library, the first in relation to content development and creating authoritative resources. You can see the example of the Infodemic misinformation toolkit and learn to identify fact from fiction, where there is a compilation of frameworks and concepts and approaches that have been shared during some aspects of this presentation, and how to then be able to apply them to challenge what is fiction and what is fact. Next slide. This relates further with content solution and resources that are there, that are available to help ourselves and share these with our communities, with our stakeholders, with our users, with our public and our clients and customers, however variously we define them, in providing access to these resources, which are relating to spot checking and questioning what is facts. The Fact Check is a project of the Annisburg Public Policy Center at the University of Pennsylvania that debunks false stories. When unsure, check for accuracy. On this site, you may also submit questions, and if they have not already been addressed, answers will be researched. Fact Check is another one, the political literacy companion to the earlier site. This site provides resources designed to help viewers recognize the flaws in arguments in general and political ads in particular, questioning the whole performative politics business that we encounter, the nature of political rhetoric and the political ads that we come across. So this is a valuable resource that we can use, as well as share these resources with our communities. Politic Fact, their main core principle of independence, transparency, fairness through reporting and clear writing. The reason we publish is to give citizens the information they need to govern themselves as a democracy. They examine the accuracy of the statements and provide readers with specific responses using their truth o meter, which explains to what degree is that information correct or not. Snopes and All Sides are other resources that you can use yourself and share these with your constituencies. Next slide. Something additional related to content solution is hosting expert authoritative speakers. Here you see the example of the Washington Library Association, and they invited two information professionals to their conference. Chris Coward, who was a senior principal research scientist at the Information School at the University of Washington. He's also the director of Technology and Social Change Group, co-founder of the Center for an Informed Policy at the university. Also, Jaren West, first director of the Center for an Informed Public at the University of Washington, that received $5 million investment from Johns and James L. Knight Foundation in July 2019 to study how and why fake news, misinformation, and disinformation are created, including research, education efforts, policy, and advocacy. He also co-directs Data Lab and other institutional units at the University of Washington. So bringing people who have had experience and who are continuing to do research and challenge what we understand is truth in the context of the infodemic is another role that libraries can continue to play. Can I have the next slide? Here we find an example of skills solution of critical thinking and information literacy from the National Library at Singapore. And we have Mazlan Anwar, who is the senior librarian at the National Library in Singapore, who has created a video on YouTube, and where he's talking about the news in the gallery, an exhibition that took place in January 2020. And this exhibition involves a virtual interactive platform where visitors can learn to be more discerning about the information and media, with several examples through the history of Singapore, including the chewing gum ban that was made in that country, an example of a case where an adoptee was returned back to the Dutch parents in taking the child away from the foster mother from Singapore. These created a lot of public activism and created a lot of dialogue and discussion in the public forum. And so this exhibition helps identify the different elements of what was sensationalism, what were the agendas that were at play during these different events and incidents that took place in the recent history of Singapore. And so it helps through the process of critiquing and analyzing these events through the exhibition. It helps users and the public understand the different dimensions to the issues that were there in terms of what we are now encountering in an infodemic with the coronavirus pandemic. Next slide. Here you can see the examples of the frameworks and the checklists and the approaches that had been shared earlier in the presentation. For example, CRAP, currency, relevance, authority, accuracy, purpose, and then the IFLA checklist that was created. These are theoretical and they seem abstract. So we have to be able to find ways to apply them in real situations. And so in the middle, you can see the example from Alison Campbell, who has applied the concept of CRAP to the pandemic. And the pandemic, as many of you know, is not a typo. It is a situation where a pair of 2020 conspiracy theory videos were produced, and they presented falsehood and misinformation about the pandemic. And so the author here applies the concept of currency, relevance, authority, accuracy, and purpose to this particular situation in highlighting the limited validity and relevance and accuracy of the information that was presented in relation to these incidents that happened. Next example, next slide, sorry. And so here we can see a resource, credible. Again, some of the concepts that we've touched upon earlier, currency, references, explicit purpose and intentions need to be identified, disclosure of developers and sponsors, interest disclosed and not influencing, what elements of objectivity are there, balanced content labeled with metadata evidence. These criteria are then being applied in the context of web resources related to health. How do you evaluate and assess health information support services that are getting made available on specific websites through authoritative and unauthoritative sources? Next slide. Here is again further topic of skills solution, that we should be able to recognize and report matters related to cyber attacks and crimes. And of course, these are bigger than only the coronavirus disease and COVID-19 and the infodemic that we are encountering. But they are within the larger nested reality of any aspect of our experience related with information where we are encountering these problems. And so this here is the fact that there are mechanisms in place, whether we can directly report to the government, we can report to various organizations where that particular information says it's coming from, and we can of course report through various online platforms about incidents that might happen, in terms of making sure that we are taking protocols that help us in securing, making ourselves environment safe, and resisting and providing mechanisms which support cybersecurity protocols. Next slide. Here is again skills solution, looking at recognizing and stopping the infodemic. So a strategy coming from the WHO's Mythbusters in flattening the infodemic curve. How do we make sure we question, making sure that we do not pass on the rumor to group chats, for example, in the diagram on the right. Make sure that this person is getting the news from trusted sources. Make sure we are double checking the facts. Make sure questioning, how do we know what is true? And so there are some infodemic preparation elements in a checklist. For example, replicating what happens in natural disasters of earthquakes and hurricanes. We have specific steps that we can follow in terms of planning ahead in case of an infodemic or disruptive information and communication services. This is especially important if you are relying on electronic sources or mail delivery. Make sure that you have backup power source, for example. The second one, make sure that you have your information literacy checklists at hand so that you can go to those sources, printing them and storing them. Don't forward rumors, talking to neighbors, workplace, and school to know, how do you know that this is true? And of course, these elements need to be circulated with our constituencies in addition to sharing them with our colleagues. Stay information component. Keep yourself updated with current knowledge that might be emerging. Next slide. So here again, further aspect of research advocacy policy solution, spotlighting best practices and promising practices that are emerging. How are different libraries following different strategies? Here is an example of the Nazarbayev University Library in Kazakhstan, who are part of the Global Media and Information Literacy Week that was hosting a panel to enrich media and information literacy experience conversations, complementing the efforts of the UNESCO and its partners. And it had expert authoritative panelists, Lisa Janik Hinklich, who was a professor and coordinator of the Information Literacy Services and Instructions at the University of Illinois at Urbana-Champaign University Library, Jesus Lau, professor at the Universidad Veracruzana in Mexico, Zera Gactiga, the head librarian at the Beacon Academy in Philippines, and Edson Tandok, associate professor at the School of Communication and Information, Nanyang Technological University in Singapore, and also Professor V. Kim Wee. And so these authoritative individuals who have been working in these areas were invited by the library and were able to apply some of their knowledge to the practices and strategies that the library was adopting. And you can find the YouTube video documenting some of these experiences that were recorded in the panel. Next slide. And here we have the Cochrane Library, which is at the Medical Research Center at the National Institutes of Health. It is a collection of databases that contain different types of high quality independent evidence to inform healthcare decision making. This is created and developed by the Wiley publishers. And this project is really a valuable one in terms of storytelling and lived experiences. So advocacy does not only mean advocacy for the library institution. It also means serving as partners and collaborators with our constituents, our community constituencies, in helping them become part of the process of contributing to the body of knowledge and information related to the infodemic. And so documenting their stories and their lived experiences. In this project, 100 people with lived experiences related to COVID-19 volunteered to contribute to our rapid review work. And so they emerged in the role of citizen scientists, collaborating and being able to partner with the library in adding to the body of knowledge about the pandemic and, of course, emerging as key players in responding to the infodemic. Next slide. Here is a slide that was shown earlier, again, drawing attention to the role of advocacy and reporting when we are encountering health-related misinformation and other information related to creating infodemic, false news, fake news, misinformation, disinformation. Many of you mentioned, some of you mentioned malinformation on the text chat. All those dimensions, you have now mechanisms on the various virtual platforms where you can go and report when those incidents are happening. And so that means it's a more proactive role than the passive neutral stance that libraries used to take in the past. Can I have the next slide? And so closing with this slide, which is recognizing that we are the solution. We are also part of the solution, and we need to be involved in self and collective care. So here, this is a resource that is created by Nomads magazine, which connects libraries and their communities, and it also connects people together. It's a message that you can contribute to on this map, a message like a form of a love letter of hope and encouragement to fellow librarians around the world. Click on the map, indicate your location, leave words of encouragement and hope that will inspire joy to other librarians worldwide. And you can click on these pink hotspots that are marked around the world and be able to see examples of recordings, audio, video, recordings that people have contributed about and from their libraries globally, and what efforts have they been making and what efforts can they continue to make, as well as be able to provide support and encouragement to each other. So that was a lot to absorb. And so can we have the next slide? And so let's now open up the conversation and continue to get more questions and feedback from all of you. for all of us on the panel. Please feel free to use the text chat to be able to share your questions, and we'll have all the panelists respond accordingly.
I can help out, Bharat, with the question and answer ones. Maybe we can start with those. And actually, I may start us off with one question that was asked earlier by Brad Wiles, I think. And he asked about, what do we know about the efficacy of information literacy? And is there a cumulative effect? So we are, as library and information specialists, promoting that information literacy allows us to think critically and know how to examine. So do we have any evidence of that, the efficacy and the cumulative effect?
I think I would respond just to start the conversation going, and Kendra can jump in, and Clara yourself too. Here is that I think we have to be first, as one of the examples that we saw, spotlighting the efforts that librarians are making. And only when we are able to document what we are doing can we then be able to find ways of making sure that that the strategies that we are adopting, that they have an impact, that they have a role of efficacy of making a difference. That would be kind of my first response to that. A second aspect is, of course, relating with our constituencies and communities and being able to connect with them to see how their thinking has changed or not, thanks to the information literacy dimensions that we are providing in terms of the resources. Do you agree? Do you think there would be additional ways that we can respond as librarians and information professionals?
Yes, I think that you're right in terms of the need for more empirical evidence, and also in terms of practice. I think one person indicated that there's more need for teaching information literacy in different parts of the world. So are we actually applying this kind of knowledge and skills around the world? And then we need the research to indicate how efficacious and impactful it is.
I'll add one thing to it, and this is just from my own practice, and that is that when we're working with a particular target group, for example, when I was at University of South Carolina, Karen Gavigan and I worked on a project to help African-American teens learn about HIV, and this could be true for any target group. Some of the work that we had done collectively, she and her own work and me and mine, we came together and realized that when you're working with a particular target group, it's very important to include them in creating sort of an output of their own understanding of what the information is that they're consuming. So in our case, we took these African-American teens and had them tell us a story about how to prevent HIV/AIDS. And then we shared that story with other teens and got their input. And pretty soon we had created a graphic novel, like anime, for those of you who may not know. It's like a comic book sort of. And this comic book told the story of a football team, and it's a story of craziness. It's funny, but it's a teen story. They created it. They wrote the story, and they included factual information in it to make sure that when they told the story, they told it in their own language of being a teenager, as opposed to a middle-aged white woman. Here's an African-American teenage group writing the story in their own words, but making sure that they checked the facts to tell the story, and then sharing that with others. And what we found was that we tested their knowledge before they read the graphic novel, and then we tested it again after they read the graphic novel. So we could see what the knowledge gains, that information literacy output really was. And then we tested their knowledge before and after they read materials by the Centers for Disease Control that we're targeting for teens. And what we found is that when you have information that is interpreted by a particular group and they can express it in their own ways, they demonstrate a certain kind of understanding and literacy that comes from that. It's a small example, but we did it repeatedly with probably up to 200 to 300 students, I would say, over time, teenagers. And so I think taking into account that librarians, somebody had said we need to get out of the libraries and into the community. I think this is an example of that, where you actually work with your target group or a subset of your community to help them really interpret and understand and make sure that they're understanding. We can provide facts all day long, but if they're not understanding them, it's not going to help them as much as having, rolling up their sleeves and helping them understand and trying it out and to express it themselves so that they really get a strong sense of what they're understanding. It's a learning process. It's not just providing and disseminating the information.
Barat, do you have access to the Q&A? Would you like to
Sure, yes, sure. I do see the question, next one. So what evidence is there now that it works on a more significant scale, especially in the social media driven information environment? I think we as librarians assume it works because why else would we invest so much time, effort and resources in it? But I think there's a lot of evidence that the impact has been very minimal. Not saying it isn't worth the effort, but the pandemic shows that the stakes are very large, coming from Brad Willis.
Okay. And
Yeah, there is a question here I can just share with you. It's asking about, are there any statistics or anything beyond this account that gives some evidence about use and efficiency of library information literacy initiative? It's covered extensively in disciplinary literature. So he's wondering, is there any cumulative impact it has had?
so
Yeah, he's asking about is there evidence or some statistics that supporting these initiatives in this one.
right. I'm not aware of any, but I'm sure that there must be. Barat and Kendra?
Mhm.
I think some of the examples of, not in terms of statistics, I go as a qualitative researcher beyond just the quantitative evidence. And so the examples of the case studies and other, when libraries are telling their story and spotlighting their efforts, to me, that is illustrative evidence of making a difference or documenting what they're doing so that others can replicate that. But I'm sure there are some resources through the government agencies that are the different state level library organizations, at least in the United States, have documented efforts of what they are doing in terms of the numbers in their state, in the public libraries that might be part of those state systems there, at least in the United States. I know that evidence is, we have access to many of them online that the states are making available on their websites.
Mm-hmm.
Perfect.
I would just add to that I think Barat's exactly right. I think there are pockets of this kind of information that are available for individual research studies. I don't know because I'm not, that's not my area of research, but I would guess that there's not a lot of information that's gone out and collected all of these stories and all of these studies together. And it would be really hard to translate all of those into any statistical numbers, but I certainly think we have a sense that these programs are effective. I can certainly say from our own research in the graphic novel that we found that was highly effective, and that there are a lot of studies. School librarians, I'm not a school librarian, but I know that Karen Gavigan, my colleague, she worked in school libraries, and that they do a lot of work in working with literacy and scaffolding up reading. So I think there are some close correlations there, and that when we look to learning, that we find that there are some as I said, some definite research studies that would support that these are effective.
And I
I know, for
guess,
example, sorry.
go ahead.
I know, for example, when I've been working with the rural librarians in the Southern and Central Appalachian region, the Association for Small and Rural Libraries has made some efforts to compile some of these stories through the venue of their conferences and such. But I just want to put a word of caution again that we have to be careful that we don't just rely on the quantitative data sets. I think it's the richness and the complexities and the problematic dimensions and the effective solutions that are emerging in response to those problematic situations, which are so unit level, region level. So those we need to recognize that those are also important modes of our data. It's not just the quantitative data. There is much more layers of issues that are emerging through the storytelling experience, more than anecdotal, because it is applying systematic, deliberate ways of capturing those. And so that's one of my comments to that question.
So I wanted to also emphasize that we have focused a lot on content and ensuring that, we provide content that's authoritative and balanced. So it's not like negating something, but showing the different types of information. So there's discernment. And then that it's literacy appropriate, meaning that if somebody has low literacy, then to provide information that may be in the appropriate language and using images. And for children, that would be the case. And also if you have speakers of other languages, to provide information in those languages, and then to have expert information that is shared. And so we also focus on skills. And I think to ensure that there is efficacy, then to do what we have indicated, which is to start early, and that this is a process that not only do you start early and then do you share it in schools, but then it be throughout the whole process as a lifelong learning skill. And then the critical aspect in terms of the research that we need, we pointed to what is called convergence research. So with convergence research, our research tackling those really difficult situations where we need collaborative research, we need multidisciplinary research. And the more as library and information specialists, we can be involved in those research teams, then we can provide the kind of critical knowledge that we can contribute to assisting in addressing and understanding these issues. So I think if we can play more and more of a role in this last area of research, advocacy, and policy development would be continued contributions that we can make from the library and information field.
Thank you.
So
I think there is a question from Fatima.
Okay.
I think she's targeting this question to Kendra. She needs more enlightenment on the difference between infodemic and misinformation and disinformation. I think maybe you already had it in the beginning, but maybe she needs to have more clarification on it.
I'm sorry, could you repeat the question? I'm sorry, I just didn't hear it.
To have more enlightenment on the difference between infodemic and disinformation and misinformation.
Oh, well, I think that when you have an infodemic, what you're dealing with is just the fact that you've got a lot of misinformation and perhaps disinformation. I think in the case of COVID-19 in the United States, there's been a lot of disinformation for political reasons, and I hope that's not too much of a stretch. I don't think that is. There's been a lot of politics associated with it, and it's created a lot of disinformation that's been difficult to make sure that we get the correct facts out. And so when you have mis or disinformation in an infodemic, it just creates bigger barriers to to be able to overcome in order to get the information accuracy that you need there. We were fortunate in Uganda that we did not have an infodemic per se. There were pockets of misinformation predominantly coming from the indigenous medicine community and some of the faith-based community because of just their own understanding of things. And that was probably the bigger challenge of anything. But when it's a very high proportion of disinformation that's being put out, it's hard to overcome. And that's the lesson that I think we're learning in the US right now is how do we ensure as information professionals that we keep that, we keep the course, we stay the course, making sure that we continue to stress and to provide factual information that stays out of the politics, that just keeps to the facts that are available to us. And so I don't know if my other colleagues want to add to that, but I think that's really the case, is that we have to be sure that we continue to do community outreach and make sure that we're getting the message out that's factual. Clara or Bharat, would you like to add to anything?
Sure. So one way that I would distinguish it is with infodemic, it's more the phenomena. So all of this is happening. There is information being shared. Information is not accurate. Some of it is accurate. It's hard to figure out, what is happening and difficult to control. So then infodemic is, I think, to think about it in terms of a phenomenon that is occurring, and this these things that are happening that are hard to stop, and it's spreading. When you think about misinformation, disinformation, then as Kendra indicated, is the difference is in the intent. But what is happening is these particular cases. So there is misinformation happening, false information that's spread, or disinformation, which is intending to create some havoc, some harm. And so these are more particular cases. So when you have a lot of misinformation and disinformation happening, this is all part of the phenomenon of the infodemic.
Thank you, Kendra. Thank you, Clara. I think related to this question, there is another question from Professor Amalwa Mustafa. She is asking about more ideas about the role of librarians with children, mainly children, to protect them against the misinformation and the infodemic.
So in terms of children, it's important to deal, I think, both in terms of specific things that they can do. So currently in the COVID-19 pandemic, then, to wear your mask and explain why it is maybe we are not going to visit grandma and other kinds of things. And then if there are situations that a case comes up of misinformation, then to be able to describe and maybe just take those simple strategies of walking a child through what is the identifying characteristics of factual information. So I think that even children with simple examples can learn from this process.
Perfect.
I agree with Clara, and making it more as specific. So some of maybe storybook examples, and relating the application of some of the concepts of CRAP and some of the other aspects that we've seen in the frameworks and checklists, applying that to the narrative that might be happening at the level of the kids learning in relating to what they connect with, and being able to then show them what are the gaps that are there in the resource that they are looking at.
I would only add to what Clara and Bharat have said, and that is that it's important to keep in mind what developmental stages children are at, and that they need to be the information needs to be targeted to what their developmental stage is. You know, what information you provide to a 5-year-old is going to be very different than that you would provide to a 17-year-old. So you just need to keep in mind their developmental stage and address the information needs of someone at that age. Yeah.
I wanted to comment on one of the earlier questions that was about the mis and the disinformation. And I think one saw in the theme, one of the themes that emerged from the text chat about politicians playing a role in spreading intentionally misleading, for example, disinformation. And so I think there are 3 thoughts which are responding to in that context. First of all, I think we have to again be more proactive. As my colleague and friend Jose Aponte from the San Diego Public Library stated, dancing with the elephants. So we need to be getting out there into the public forum with the movers and shakers in our communities, whether it's judges and lawyers and politicians, and holding them accountable through these resources that we have available to us in challenging by presenting evidence-based facts in response to those disinformation type of aspects that they are sharing. So it's going beyond our neutral, passive roles in the past. Again, that theme. Also, opinion is not fact. And so I think Kendra had that in one of her slides and drawing attention to that in the process of holding people. And of course, we do that in our own forums through news media and channels, but then we also kind of work with our user communities to be able to make them do that as well in holding people who are spreading disinformation accountable first. Second point about that is also sharing within our own selves in community, in our own library and information professional community and outside with our various stakeholders, that within a neoliberal climate, everything is a commodity, and so is the news, and so is the political statements that people are making. We all have this desire to get entertained, but drawing attention to that with our communities and recognizing that when we are all getting emotionally and psychologically impacted by the spread of disinformation within an infodemic, we have to be able to recognize that and making people aware of the fact of that might help help them understand their integration and absorption of the disinformation and the infodemic realities that they're encountering. And the third one is that it's not easy answers and it's not linear cause and effect. There's always an agenda, most probably an economic one. So we have to reveal the layers when disinformation is getting encountered by our constituencies and reveal those agendas in that process. And it's not a quick fix answer or response here when we are interacting with our constituencies. We have to be recognizing that it's not a 2-minute noodle cooking that is happening in the microwave oven. It's a way of complexly revealing the different aspects of the situations that we might be encountering. So those are my comments related to the earlier question. Thanks.
I see that there are questions in chat, but also there are 24 in the Q&A. So maybe I can read the first one in the Q&A from Carolyn Coward. Often misinformation and disinformation is in circulation before the accurate information and becomes accepted as truth, preventing accurate information from taking a foothold. How can we prevent this rejection of facts and the truth? Does one person
I think sometimes you can and sometimes you can't. There was a wonderful dissertation done by a woman named Shannon Altman, who is at University of Kentucky now. When she did her dissertation at Indiana University, I don't remember the second case, but the first case was that she traced the idea of global warming in the Department of Energy from the scientists all the way through the press releases, through the public relations office, to what the public was going to be told about global warming. And so she traced it starting with the office that put out the public messages where the phrase global warming had been changed to climate change. And in the United States, global warming was at the time considered to mean caused by human activity, whereas climate change could be caused by human activity, but was more likely to be caused just as a natural weather cycle or a climate cycle. And so she traced it back. She went to the public relations office and talked with them, and then whoever got it to before that, and all the way back to the office of the scientists, the research labs, and the data scientists, and looked at how that message had changed, because the scientists said it's human caused, it's science, we have the evidence, it is human caused, it's not climate change, it's global warming in the sense that human activity is causing more extreme weather, the things we've done in terms of emissions into the atmosphere and pollutants in the environment, greenhouse gases, et cetera, were all caused by human activity, and that's what was the cause of it. But the press release office had said they'd watered it down, so to speak. They had diluted the message and said, well, it could be, but it could also just be a normal natural weather cycle. And so that created a tension between scientists and politics, which often, as Bharat's previous answer, you can see exhibited right here in this particular case. And so I think the answer to your question, Carolyn, is that, you know, sometimes you can and sometimes you can't change that. The question is, at what point can you change it and what point can't you? In the case of our work in Uganda, it was at a more personal, almost at a community level. And so we were able to, you know, leave the library and go out into the community and have them understand the facts as were presented. But actually, I would argue that we didn't do that, because I can't go into that culture and have them believe me. I'm not from that culture. I don't even speak the languages that we were working with of the communities. So I didn't do my own research, my own data collection. But so the team of researchers that we had trained to work with, who went on the ground in Uganda to talk to these people, did a lot of education after they had collected the data. So they were actually informing people. But that was what was so interesting in that particular case, is because the way that Uganda was structured with those 7 layers of government and all the content and strategies, these people already heard about it. They already knew about it. This was from the level of their community communications people. You know, the grapevine in Uganda is very strong because of oral tradition. And so they had factual information already. So there's different levels of information. There's macro levels where you're talking about the politics and how that filters down. And you're also talking about the community level that's almost from the bottom up. Yeah.
Carolyn, that was a really great question. And I want to add to what Kendra said. Yes, that when it's a shaky, when the complete information is not there, how do you make sure that when disinformation is emerging as a shade of infodemic within the infodemic situation, how do you address and stop it? And I think one of the aspects is that you address it head on to indicate that it's not a complete information available at the moment, and that it's a shifting reality. As more data and more rigorous research is emerging on the topic, we will be able to become aware and clear. Your example of the pandemic is a great situation there, that when in 2009, Dr. Judy Wikowitz presented her research of the murine as a way to address the chronic fatigue syndrome at that time. In 2009, the journal, very well reputed, Science, published that. But of course, from that time, it was found that findings were not substantiated. And when others went through applying and replicating some of her processes and procedures, it was found that it was not correct. And so they redacted that article in 2009. So if we had questioned that the rigor and the completeness and the applicability of the research in that case had to be replicated additionally, that would have led to addressing that matter. But the data was not there at that time, right? And so how do we address that in the case of an infodemic? How do we address it is by pointing out that new research and data is going to continue emerging, and we cannot, based on what we have right now, this is where we are, but it's not the complete. And so when we encounter some of these statements, it might be appropriate to question and bring attention to that.
Thank you, Bara. Clara, I think there is, Chris have two questions, one related to WHO and the other related to question. If you just summarizing them for the...
Yes. Would you mind, please go ahead and read them? And
you can go ahead and within one time, because we have many questions, so you can put it in.
Okay, I'm not sure where that one is, so that's why I thought if you can read it, if you see it, then thank you.
Asking about what do people think about WHO making a third attempt at setting up an internet health domain to house its academy and other trusted sources of information. And the other part is the geopolitical climate has changed thanks to COVID-19, and the world might be ready for listen now. It can no longer be health. He's saying that it's just not just on health. I think it's bigger than this one. I think the main question is he's talking about that what the WHO published, and is it be the first source we knock its door in the library? So Kendra, if you would like just to jump in and answer this one.
Well, I have you may hear a barking dog in the background. I apologize. So I don't want to.
It's about the side effect of COVID-19.
You know, that's a really interesting question, Chris, that you've raised, and I'm not really sure that I have an answer for that, because that's a question. It's more like, should they do it? Yeah, I think they should, but whether or not they will, and it's a very complicated answer because it's a hard question to know, because it deals with how the structure of that organization is set up. And I actually am going to defer this, because the dog is barking for the moment, to Bharat, if that's okay.
Sure, thanks. And then I'll pass on the mic to Clara. But my comment on that is definitely that, again, I mean, I don't believe in the top-down approach. So, but the top-down, the world, the resource having at the international level that is getting developed has to be built at the national level, has to be built at the state and the regional level within the nations. It has to be built at the local unit within the states, the districts and the regions which are creating the state. So I believe in as Gandhi's Panchayati Raj system. But the data and the information has to emerge from all those levels, and it has to be collected and compiled and presented at the larger level, and the resources might be available to create that infrastructural mechanism top down. But it has to be connected with partnerships and collaborations from the unit, from the most grassroots level, in order to get accurate and authoritative information about the realities that might be getting encountered in those local levels. And so I would say that it's great if those kinds of information flows are established and built from the top-down level to the local level at the grassroots, in order for it to be, of course, what is contributed in it, and of course how that would then get used and applied in what is created in those kinds of resources. Clara.
Yes, I think what we've learned already is that now technology is available to be able to find solutions that all of us might be creating this web of interconnections. And so one of the areas of interest for us to think about is the notion of collective impact. So if you are familiar with this term, then collective impact is a way that many organizations come together to address the most challenging social issues, we had talked about convergence research, there's also collective impact. So when organizations can find that within their missions, they have particular goals. And if those goals are shared with other organizations, then you bring together the multiple expertise, the multiple resources. So you're no longer just duplicating efforts. And so one is that we work together as organizations and find ways that we can connect the information with each other. But then if there is an organization like the WHO who can coordinate, then if there can be a coordinating body, whichever that is, because oftentimes we don't have that kind of coordination. So as we know from the work of the World Food Program, that is a United Nations entity that won the Nobel Peace Prize, they are using technology where they're distributing the food, and they no longer worry about whether each organization that has donated the money is tracking certain things. What they are able to do with their technology is to ensure that the way that the food is distributed is in accordance with the different organizations, but not worry necessarily that everybody has to have shared or controlled information. And so there is a coordinated, distributed approach is what I would suggest. Those who can come together, those who can fund it, and those who have the expertise all need to work on it. And it's not just one particular entity's problem to solve, but a coordinated approach.
Perfect. Thank you, Clara. Thank you, Bharat. We have from Ali a question, and I guess that he's a researcher, because he asking that, do you think that Infodemic could or will be one of the models of information science for the future alumni? I think he's seeking for something for his thesis or master.
Yes, I think definitely. What is wonderful about our research community, if you look at some of the research already coming out of the iSchools, the information schools, as well as the Association for Information Science and Technology, that the conferences which took place this fall were already reporting research on infodemic and also other responses to the pandemic. And libraries also have shared, not necessarily on the responses to the infodemic, but they were sharing responses to the pandemic. And so there is a lot of fodder in terms of research to do. And from the many questions that we've had, all the way from, do we have enough data, and we don't, on whether information literacy is a good solution, a good strategy for an infodemic, and all these other approaches that we indicated. So yes, and definitely if the research can be done in a multidisciplinary way, I think the kind of understanding will be more holistic and provide a better solution, or even just beginning to understand what the concerns are.
Excellent. I can pass the same question for Professor Bharat and Kendra, if you need to add from your academic background, please.
Kendra, you want to go ahead?
Yeah.
The only thing that I would add to what Clara just said is that, and it's just a word she left out, and it's not, she implied it, and that's the impact, that multidisciplinary approach will be more impactful if we have more teams of interdisciplinary people working together. The impact will be automatically greater. And as research, as far as the research community goes, I think this is also necessary to be reflected in where we put our research out. I think the one thing we could do a lot better is not just tell each other about our great work that we do in the library and information community, is not just to publish in our own journals, but to get the word out to other people. It doesn't help us to sit in the library and say, gosh, we're good. You know, we really need to show why we're good, and we need to tell other people about it so that they understand the important contribution that our field makes to research, especially in an area like this. We are the experts about these things. So this is a good area for us to be telling other people. Yep.
And I want to build on Kendra's point that we really do need to extend ourselves. We can't keep being looking inward. Information professionals, librarians, all of us in the diverse and variety of our professions, we have to be pointing out that, for example, the coronavirus or COVID-19 pandemic is, and I think now we are beginning to look outwards, that it is an information problem, and bringing in aspects of information-related constructs and concepts and approaches and strategies that help our stakeholders. Are we on the table with decision makers in the World Health Organization or at the UN or at other levels? So pushing ourselves to be looking outward in order to indicate how it is an information problem, or what are the aspects of information that plays itself out in particular situations. So building on what Kendra said. And second point is, I think the question that Chris had also, that information literacy is not a solution, it's not working. That we have to be critical to our own traditional approaches and methods and mechanisms and terms and other vocabularies that we've created. Information literacy, critical information literacy has to be applied in community context to specific situations instead of an abstract level. So being able to challenge ourselves in what we have done traditionally to be able to keep ourselves open in bringing in new interdisciplinary and multidisciplinary aspects that my colleagues mentioned. Clara.
I don't have anything additional to add, but I'm wondering if, I think Kendra does maybe.
I do.
There was one question that I know I'm looking at the time and we have about 10 more minutes before we wrap up. But there is a question I would like to follow up with after you provide your comment, Kendra.
Thanks. I just wanted to follow up on what Bharat was saying about Chris's comment, which in the chat he says, I would hazard to suggest that that information literacy is proving insufficient when dealing with recent mis/disinformation because it underappreciates how misinformation targets people's emotions and other psychological triggers. A rationalist cognitivist approach will only get us so far. Thoughts from the panelists. I really want to address that because as far as I know, I think I'm the only person that's doing psychoanalytic research, which is focused predominantly on information, on the ways in which information triggers emotions in people and why. And so that was the psychoanalytic was the theoretical foundation for developing the graphic novel that we did. I'd be happy to talk to you in more detail about that. But for those of you who are not really aware of that, when we talk about cognition and how we learn and how we think about things, that's a different thing than when we talk about the way we feel about things. And there's a great psychologist at Emory University who has done a lot of research and suggests that up to 95% of our decisions are made outside of conscious awareness, that we do it from that deep down gut feeling. And so if we spend 95% of our time looking at the cognitive aspects of it, we're really missing the emotional aspects, and that's really important. And so I feel like a one-woman crusade in that regard, and I'm glad you asked that question because it gave me the opportunity to say how important I think this is. So it's an important aspect to look at that 95%, if you will, that's below water, that we can't always articulate. How do we know how we feel? We don't always know how we feel. And so when we're having issues like life and death questions, it becomes even more important as we deal with issues like COVID-19. How do you help people cope through those things about those emotional things? Thank you.
Kendra, there was a follow-up question in terms of what is the title of the graphic novel?
The title of the graphic novel is called AIDS in the End Zone. It's a football story. And for those of you who don't know American football, the end zones are where you score. So on the football field at the end zone, that's where the score is made. And it's about football players who have a great rivalry. These are teenage football players who have a great rivalry. And one of them is he's a very bad person. And he decides to see if he can get the other one, his new rival, infected with HIV/AIDS from a girl he knows who is HIV positive. It's a very dramatic story written by teenagers. And so it's an interesting story, and we got a lot of press out of it. The New York Times picked up an interview with us, and it's on, you can buy it on Amazon.com. So there you go. Thank you.
And just also quick reference question. Who is the researcher from Emory who indicated 95% decisions are made outside of awareness?
His name is Drew Weston, and he and a guy named John Shedler from Colorado do a lot of work on this psychoanalytic theory. And you can find their work. You can Google them and find a lot of stuff. They came out with a press release. Gosh, it's been 10 years ago. In 2010, the American Psychological Association put out a press release about some of the work that they had done, indicating that psychoanalysis as a therapeutic method had a far greater long-term impact on people's behavior than cognitive approaches. And that was one of the reasons it caught my eye, was because I had worked with psychologists at my university, and they also indicated that there was a lot more to the psychoanalytic theoretical perspective than to cognitive for the kinds of work that I was interested in, which is looking at the soft underbelly of human emotions. Yeah. Drew Weston.
So then I'll follow up with that question that I thought might be good for us to make sure to cover. And it's from anonymous attendee. I like the idea of libraries taking a more active role rather than our typical passive role. However, I worry that we don't always have the expertise needed. I have been surprised by some of the biased information that I see coming out of libraries this year, and my own library colleagues have not always evaluated information before sharing. What do you suggest that we do if we see our colleagues share biased or not quite credible information, especially if there are library leaders who are in positions of power?
Great question. I think drawing attention to some of the resources which challenge the information that is getting presented might be one strategy to draw attention to the gaps that they're presenting. I think that would be a starting place.
I'll go next, I guess. For me, then, I think it's come up to the situation of the emotional aspect. Sometimes if somebody has already shared it and they probably have a kind of strong belief about its credibility. And so for me, it would be trying to problematize the situation, kind of like peel the onion back, which is just to ask, can you share more information about where this comes from and how, what has led you to understand that, this is information that is factual or accurate. And I think that just to have them reflect on their own thinking of why they're sharing the information and why they believe to be true. And I think that if we can have that as a beginning conversation, then we might start to be able to share, where does information come from and what are different perspectives, or what is information that sheds light on a particular situation.
Perfect. I think we have 5 minutes left, so I think this is my right to have a question. I left all the attendees and we have many questions, so I encourage all of them send it over the email, and we will answer it and follow up. And also I announced that the certificate will be sent over via email for everyone attended. My question will be for each one of you, Professor. In 1.5 minutes, each one just can recall a specific outstanding case for library that you said that it's did a great job during COVID-19 along the past year that we already almost at the end of 2020. So let's start with you, Clara. Can you mention with us within this 1.5 minutes a specific library that did a great job and why she's very distinguished?
Okay, so I think that there are many libraries who have done excellent work. So I don't necessarily want to point to a particular library. I think what we probably do best is if we collectively work together. And so there are many resources that from an international resource are available through IFLA. And then in many of our own particular countries, we probably can link to particular areas of where wonderful resources have been compiled. So if we can look to each other for information, because some solutions that are available in one country where they have a lot of money is not the appropriate solution for a small town that doesn't have many resources. So my answer is that we look to each other collectively to find those solutions. And I just want to draw back to this love in the times of coronavirus, that we can support each other as librarians. And so the message that came from the Mortenson Center for this effort is that we introduce a quote from Maxine Hong Kingston, and it reads, "We are all under the same sky and walk the same earth. We are alive together during the same moment." And then we said, during the COVID-19 pandemic, we are observing the fortitude and creative spirit of the library community. We see you, your impact within your community, and together we will come out the other end, changed but resilient. Thank you.
Thank you. It's the best wrapping up, and at the same time, it's a very smart answer that open the gate for searching and finding more and more outstanding case study and experience. I would like to thank you all, appreciate your engagement and this wonderful sharing of knowledge. Thank you, Professor Clara. Thank you, Professor Kendra. Thank you, Professor Baharat. And for sure, from my side and on behalf of Naseej Academy and Naseej, we are looking forward to have you again in the coming 2021 years, which we hope all, as we are on the very close time to the holidays, pray and hope that the coming year will be more optimistic and more have more luck for all of us and for the humanity. Thank you so much and I appreciate it, and thank you for the attendees. شكرا جزيلا للحضور, and I leave you if someone just need to add something for this. Appreciate it. Thank you all. Appreciate it. Have a wonderful day. Okay, bye-bye.
Thank you all. Thank you to all the wonderful people and questions and your institutions, and best wishes for the new coming year 2021.